different inheritance patterns. So firstly, we are focusing on the X-linked disorders. So in cases of the X-linked dominant, so here it includes the females. They are affected twice. So females are affected twice more than the males. This is in case of the X-linked dominant. And the females has a 50% probability of transmitting to the son or the daughter. And whereas the affected male, they transmit disease to all daughters, but none of his sons have the disease. So in case of X-linked dominant, the affected male does not transmit the disease to the son. Next we look at the X-linked recessive disorder. So here the males are more commonly affected and the female carriers are unaffected. So in case of X-linked recessive, the males are affected, the females are unaffected. And next, looking at the affected father, he will have all the daughters to be carriers, whereas the son is unaffected. So X-linked recessive, it is only the daughters who will have all. They will be 100% to be carriers, whereas there is unaffected son. Next, the female carriers are at 25% risk of having an affected son and 25% for the carrier daughters and 50% chance this is of having the normal children. Next, we move on to the autosomal disorders. So firstly, focusing on the autosomal dominant disorders. So in case of autosomal dominant, there is a vertical pattern in the pedigrees. The individuals of each generation are affected. So they include the parent and the children. So in autosomal dominant, the males and females, they are equally affected. And the affected individuals has a 50% chance of passing on the deleterious gene to the offspring. Next, looking at the autosomal recessive disorder. So here there is a horizontal pattern in the pedigrees. So there is a multiple affected members in the same generation and there is no affected members in the other generations. And next, here the males and the females are equally affected and the manifestation is only in the homozygous state.